Yeah, thank you. So at the outset, let me congratulate Dr. Jayakrishnan and team KMCT for taking up this very, very important topic, which is so relevant today, and also having given me an opportunity to be a part of that. So talking about this today's topic, we have with us today Dr. Jayakrishnan, who's the apt person to give us an insight into the opening topic of the webinar, Rabies, the cycle of neglect. Now, why do we term rabies a neglected tropical disease? So the CDC has included rabies as one of the most neglected tropical disease. Well, if you look at the facts, it's due to the reason that extensive efforts in developed countries have largely contributed to controlling rabies. Let's take the case of canine rabies. US and Europe has led by example. Central and Western Europe have successfully controlled them. But in most parts of the world, especially in Southeast Asia, it's remaining enzootic with around, on an estimate about 15 to 20 million people requiring post-exposure prophylaxis every year. Now, there are several forms or areas which are neglected in our country. If you look at it, there are so many areas. I think Dr. Jayakrishnan would, in his talk, throw light on each, including, a few, to mention a few, it would be lack of accurate data, weak surveillance systems, and underreporting of cases, probably from the local communities. And if you look at it, we do not have, our legislations are so inadequate. And that is the same with the ABC control programs. So in this present scenario, it is good to hear from Dr. Jayakrishnan. What are the reasons contributing to the cycle of neglect of rabies? Over to you, Dr. Jayakrishnan.
Thank you, Dr. Asma, and good afternoon to all participants. Thank you, Dr. Asma, and good afternoon to all participants participating our webinar, which is very important for the time in Kerala. Rabies. Rabies is a very old disease. Very old disease in the earth. Rabies is considered as a neglected zoonotic disease because for controlling rabies, tools are available and it is amenable to control. And internationally, rabies is targeted for regional elimination, and many of the regions have already eliminated. And we have waived eventually global elimination by 2030. And persistence of rabies anywhere in the world, any country, any state, is due to cycle of neglect, as recalled by Dr. Francois Xavier-Meslin. Francois Xavier-Meslin was the head of chief of neglected zoonotic division at WHO during last decade, and he had visited Kerala for implementation of the IDOD program and visited and stayed with us in Thiruvananthapuram. So rabies anywhere, persistent rabies means there is cycle of neglect existing. The major reason why it persists today is rabies, the disease which often affects people where deaths are not heard or where deaths are not recorded. And in the areas of the world where rabies is more prevalent, there is absence of reliable surveillance data. So reliable surveillance data are not available. And areas where disease is more prevalent, data of incidence of exposure, data of incidence of morbidity were disparately poor. And also, dog-mediated rabies disproportionately affect poor rural population. And poor rural population with poor access to all services. So it is grossly underreported. So one of the first neglect is existing or persisting diabetes political neglect of less priority. And about rabies death, no reliable data were available till date, even with the WHO. Most of the data published or we are using daily life is based on the probability tree model, probability decision tree model, or there is no realistic data. Death incidents, and WHO is now using a data 55,000 to that data shown in the left side of my slide. So no reliable data were available about rabies. Even other silly disease data were available. And about India, according to 2012 million death study data, India is estimated 12,700 deaths in that year. But we have got Central Bureau of Health Intelligence, and Central Bureau of Health Intelligence collected data from all the states and union territories of India. And according to the data available from Central Bureau of Health Intelligence, from 2012 to 20, only 6,644 clinical human rabies deaths were reported for the last 8 years. So it is not a notifiable disease even in India. It is not included in IDSP, but only reported disease. So it is grossly underreported. For reporting, there is neglect. Grossly underreported, the evidence from last 18 years from Central Bureau of Health Intelligence. And about the rabies burden, why it is neglected? The map will give the answer. The red color, it is spread in Southeast Asian and African countries. So 60% of rabies burden occur in Asia and 35% Africa. And our India contribute equal to African continent. Rabies cases, 35% of the world rabies cases are contributed by our India. And about the reservoir animal, 97% of human rabies is dogs, and more than 60% they are stray dogs. You all know stray dogs are neglected animal among the animal kingdom. As human beings are considered, stray dogs are neglected. And for diagnosis, no tests are available to diagnose rabies. As the rabies tests are concealed to our surveillance system, during infection, rabies virus are concealed in immune surveillance by interneuronal location. They are not detected by immune surveillance. And antibody response in serum and CSF are unpredictable and rarely detected before second week of illness. So the diagnosis of rabies before symptoms is not possible. There is no acquired immunity, no viremia, and it is 100% fatal. And there is no treatment, no cure, no treatment, no medicines, no research going on the cure of rabies. It is 100% fatal, even though one of the Calicut citizens have got patents for its verbal medicine. So, to sum up, rabies is a cycle. More rabies is due to the cycle of neglect. So, during since 21st century, since after the use of IDRV, we are having decreased incidence of rabies cases. The trend is decreasing. But recently, since the last 2 years, rabies case centers are increasing report from Kerala. And out of these cases, this year, more than 22 cases are reported. Out of this, 1/4 undergo post-exposure prophylaxis. So there is confusion and suspicion and panic is in our air. Why does the PEP fails? And we as epidemiologists, there is increasing number of rabies. We have to look the denominators, not the numerator only. Increasing rabies cases means there may be increasing exposure. Why there is increasing exposure? Increasing exposure means increase in human-animal conflicts. That means there is increase in dog bites. Why there is increasing dog bites? There may be increasing dog population. And when the dog population increases and human and dog population ratio there is disturbed, there may be more conflicts. And even mere increase in dog population will not lead to rabies cases, because UK have more dog population than our Kerala population, Kerala dog population ratio, but there may be increased number of rabid dogs. Why there is increased number of rabid dogs? There may be zoonotic spills from among the animals as well as from the animals to human beings. That may be the reason of human rabies. Why there is increased spillovers in zoonotic spills among animals? That is maybe mixing of wild animals. Usually rabies occur among wild animals in circulation. There may be mixing of wild animals with domestic dogs, especially during lockdown period, during the last 2 years. That may be the reason. When there is increased transfer of virus from animals to human, there will be increased reporting of rabies cases, incidence of rabies cases. And where is increased incidence of rabies cases, proportionally there will be increased incidence of vaccine failure, because PEP failure is very rare. When the denominator, increased number of cases are increasing, the PEP, even though rare, the number may increase. That may be the reason. Let us search the details. Increasing exposure. Whether it is the increase in dog bites are reported from Kerala. As per the data available from Health and Family Welfare Department, in 2014, we are having 1.19 lakhs exposure cases, dog bite cases, or animal conflict cases. And this year, till August, we are having 2 lakhs cases. Whether it is due to real incidents, usually the increasing exposure cases, we are getting data from those people reporting at the anti-rabies clinic or animal bite clinic. And if the people, more proportion of people are reporting and exposed to rabies bites are reporting at animal bite clinic, we will get more cases. But one of the thing is that most of the reported cases, we perceive that it is derived from public facility. The data from private facilities are not reported. So whenever there is increased cases of reporting of animal bite cases in public facility, there may be increased exposure. Anyway, we are having proportional exposed under the PEPs increase. It's a good sign. But on analyzing the data from all over the medical college, preventive clinic, it found that 60% of the exposures are due to cat, not by dogs. And where there is increasing canine population, according to the livestock census 2009, we are having 7.8 lakh canine population, and latest available data from 2021 from livestock census, there are 11.25 lakh canine population. Out of this, we are having 3 lakhs of stray dogs. Why there is canine population increasing along with the stray dog population is increasing? Here we are having legal mandate. Here legal framework are existing. Those who want to keep any pet animals have to get license and have to pay license free at the local sub-government, and the owner have the responsibility to get the pets vaccination. But here in Kerala, no ownership records are available from any LSGs, are not available, properly not available. Licensing are not properly implemented, and owners are not get their pets vaccinated. And it is said that if our pets, 70%, more than 70% of pets are vaccinated, there will be herd immunity. Most of the other countries, other Latin American countries, Asian countries, eliminated rabies by vaccinating their pets. More than 70%, we can get rid of this period. And what about the dog rabies? Any surveillance data available? Because we are acquiring disease from the main reservoirs of our dogs. So dog rabies surveillance, any data available? And for controlling the population, we have implemented or started ABC programs. A few years back, most of the ABC programs of our LSG, local government, are halted or hampered. So this increased canine population is due to neglect of legal framework, neglect of responsible ownership, or neglect of responsibility of the LSGs. And another is why the stray dogs are increasing. While looking back to our history, prehistoric era, in 25 to 35 years, 30 years back, our ancestors, they are living as nomadics, even before the agriculture began. They are living together with their family. There is canis familiaris. Indian dogs are with human beings, as with our ancestors, as their company, as their friends. They are staying with them. According to the Hindu mythology, Mahabharata, a dog accompanied along with the Pandavas, Yudhishthira to heaven, and there is argument with Yudhishthira and Indran about the entry of the dog. That is our history. So it is traditionally we are having dog with us, and we are having two types of dogs. Mainly, one is pet dogs, strictly domestic. Other is community dogs. In nowadays, the community dogs are expelled. Most of the community dogs belongs to a community, and there are Indian dogs, and their so-called domestic dogs are abandoned or expelled. And previously, Kerala houses have no compound walls or closed gates. Now they are expelled. They have no entry to. So there is increase in number of stray dogs are due to the expulsion of the canine Indian dogs. And at the same time, pet trade increased. During the COVID lockdown, pet trade increased, and most of the domestic, this so-called canis familiaris was substituted by pedigreed special breeds. So one of the main reasons is expulsion of the Indian dogs from our communities. One of the important reasons for increased number of stray dogs. And as the number increased, human dog population increased. There will be conflicts. And Indian dogs all become stray dogs, and homely food are denied. And we supply them edible food by waste management. We neglect our waste management. In every household, biodegradable waste are neglected, and that become edible for food waste. So, according to the animal experts, according to the availability of foods, the fecundity increased. Number of the fertilization and reproduction increased. Thus, the dog population ratio increased. At the same time, the socialization decreased. As we are companion or friends, they are family with the family. Now they are expelled. So socialization among dogs are decreased. And at the same time, they are exposed to raw bloody meat waste by abattoirs. And it is said that those dogs who feed on raw bloody meat are craving for the blood. They will bite fresh, they need fresh blood, fresh meat. So the run amok biting in the streets are increased due to our own behavior, neglect of waste management, as well as neglect of our dog behavior. And there are reports that increase in number of dog rabies increased. As per the veterinary department reports, the dog sample tested positive become increased. 2018 only 297 cases, now it is 221. Whether the increase of rabies, dog rabies was due to increase of number of sample tested. So the test positivity is not almost same. Whether there is any systematic surveillance system available in Kerala, and whether there is any death audits conducted. And as a proxy of rabbit death, whether unknown death, we have to be counted and to be audited. So here, current scenario, the dog sample success was increased. So that may indicate the increased number of rabid dogs in our state. And at the same time, the transmission of virus is increasing. Zoonotic spells, the transmission spills are increasing. There are ecological factors. From 2020-21, we are on lockdown, COVID lockdown. During that time, there is chance of mixing wild animals with the domestic animals. During that time, many viruses transmitted. Monkeys also transmitted during like that. Many other zoonotic diseases, along with this virus circulation, along with us, rabies virus was transmitted to our domestic animals from wild animals. So there is increased virus in circulation. And about the virus, whether the virus have changed, the characteristic virus in circulation, rabies virus, we are not aware, we are not known. Whether the characteristics change, which are the strains in Kerala circulation. For this, molecular epidemiological studies or rabies virus sequencing and phylogenetic analysis, this have to be done, but this part is neglected. As far as my knowledge, not under consideration by health department. And what about the infectivity? Whether the infectivity has changed the virus, whether virulence have changed due to some mutations, or where there is resistance towards the immunity, towards the vaccines, that's immune escape, we don't know. You have to check that. These are the possibilities. And we have got an example from in India, instead of Goa, they have done phylogenetic analysis, and they have now attained the zero rabies state. And Kerala, even though declared zero rabies by 2025, no attempts were done towards this direction for phylogenetic analysis of the virus to know the strain details, circulatory strains details. Then only we can come to that conclusion, virus change. And then come about the vaccine, whether it is why there is PEP failure, vaccine failure. As per the WHO TRS published in 2019, the failure of rabies vaccine is extremely rare because about 2 crore people are undergoing PEP each year, and few PEP failures have been reported in developing countries, because developing countries, Asian, African countries are having reported rabies. And almost this is the failure is due to deviation from WHO recommended prophylaxis protocol. Which are the deviations? We can look. One is delay in seeking rabies prophylaxis. The person have to undergo a PEP, vaccination and other treatment within 24 hours, same day. A lack of improper administration of rabies immunoglobulin. Mainly the deviation is failure to inject all bite sites. A lack of or improper primary wound care. And lastly, not lastly, is poor quality of rabies vaccine. We have got 22 deaths here. If we have conducted timely case-based appropriate death audit, we can come to a conclusion about this. But I think this part was neglected also. No timely case-based appropriate death audit was conducted. And rabies failure, this failure was not a new one. On my experience, when I was working at Thrissur in 2005, we have got more than 5 cases, case series cases like today. And we have got details of this retrospectively. And 5 cases, one had injury at face, others injury at finger, and 2 have forearm and forearm. And during that time, IM doses were given, IM doses, ARV IM doses. And one have taken 6 doses and REG, rabies immunoglobulin. Now, out of the 4 persons, 3 have taken ARV plus REG, rabies immunoglobulin. And the vaccine used was Dept vaccines. 2 persons have taken Dept vaccines, 1 HDCV, others the details are not available. And the first person died on after 6 months, 201, after 200 days. Others died in 3rd week itself. And on retrospective death audit, we found that the first person who died after 6 months have taken over-the-counter steroid for his asthma. That may be the reason. Other 2 persons, no other reasons were found out. And the case 4, he was a beggar, no rabies immunoglobulin was taken by him. And following this case 3, the case 3 was a young person who died on 24th day, and the same dog was bitten more than 26 persons, and all the persons were called back to our department, and we have done antibody titer estimation and found that out of the 26, 3 have not developed required antibody on the 3rd week, and we had given booster dose to them and rechecked, and the 3% developed required antibody. And about the vaccine issues in details, about vaccine issue, one is vaccine potency. For any vaccine to be given for anti-rabies prophylaxis, it should have a potency of 2.5 international unit per dose IM. And in India, our vaccine potency is tested. Every batch of vaccines are undergoing test from CR, Central Research Institute, Kesoli, then it is marketed. And after marketing, it will travel through the supply chain. It will reach our storage center and retail center in the clinic. The potency was not rechecked, but if you recheck the potency, we can rule over the hesitations by the community. And next is immunogenicity. For any given given vaccine, it should produce antibody titer of 0.5 international unit per ml at least after 14 days. We can check that antibody titer randomly. And about vaccine cold chain, it should be stored at 2 to 8 degrees centigrade till it reaches the consumer. But since it's a killed vaccine, it is said that there is no problem, not much problem. It is thermostable vaccine. And next question arises from Kerala is about administration, IDRV or IM issue. But IDRV is time tested. In 1989 itself, it was give permission to give IDRV at US, and WHO approved IDRV in 1992. And most of the Southeast Asian countries, including Sri Lanka, Nepal, all the countries are using IDRV since the 90s. And in India, the Drug Control Journal of India gave approval to IDRV in 2006. And from 2009, we are using IDRV. And after the use of IDRV, the vaccine was available to almost universally available. After the use of IDRV, there's a sharp, steep fall of incidence of rabies case in Kerala. It confined to only single digits. The next question is about the faulty technique, IDRV or subcutaneous administration issue. And studies have shown that even with subcutaneous, the potent vaccine will produce adequate immunity. There are studies available. So, because rabies neutralizing antibody titer, the estimation facilities are available in CRA Kasoli, Pungunur, NACD Delhi, as well as NIMS Bangalore. So, if you have done antibody titer, this confusion of the random population, random checks, the confusion can be avoided. And another is most of our cases, the 22 cases, that occurred in the 3rd week. And people are asking about they haven't completed the full dose of vaccines. According to the WHO newer TRS regime, 7 days, 1 week, 2 sites, 7 days, 2. It will complete the full dosage. It will complete the course of antibody. So, does in 3 weeks to consider after vaccination, full course vaccination. And about the intradermal vaccination, it is easy, effective, economic, and ethical. It is time tested. And about the problem with the rabies immunoglobulin. Rabies immunoglobulin given, yes or no, we have to check. Rabies immunoglobulin given when timing, it should be given within 24 hours. Rabies immunoglobulin should be given to all wounds, yes or no. And before giving rabies immunoglobulin, it should be given to room temperature, should be given within 24 hours with 0 dose vaccine, within 7 days at least, and to be given all wounds. And if the dose of virus is more, sometimes the rabies immunoglobulin may not neutralize the virus. In such case, failures may happen. And about the first aid, during the dog bite or any exposure, along with saliva, the virus are deposited in the wound. So, wound washing with soap and water is important. This for washing out of virus. But in case, even though there is adequate first aid, virus directly injected nerves, the first aid may fail. And exceptionally, when large virus dose was induced also, the first aid, there is chance of failure. And about the incubation period, the rabies virus causes disease by infecting our CNS. And from the bite site, it had to be travel along with retrograde axon transfer, the speed of 5 to 100 millimeter per day. So according to the distance, proximity to the virus, the central nervous system, the incubation period is reduced. And density of the motor endplates at the wound site, the incubation period will be less. The amount of virus in the inoculum is more, the incubation period will be less. So, according to the injury number, site severity, the incubation period may be short. And during the incubation period, sometimes the body with the vaccine may not build up the adequate capacity of titer of antibody. Another failure is suturing done before the vaccine serum. They may cause failure. So, exposure to face and neck and exposure to young children may result in shorter incubation period. And exposure from rabid animals with symptoms. Sometimes there may be more virus. Such cases, there may be rarely failure of cases. There is a matrix. According to the injury site, if the bite to head and neck, multiple severe wounds, or bites to children, there is a risk is high. And the status of the animal, the dog is symptomatic and died after the bite, there is more chance of a risk of rabies. So, rabies control should be a priority. And after the wider availability of tissue culture vaccine might reduce the death of toll in many areas, many of the countries of the world. And after one of the problem is with tissue culture vaccine is cost. By converting it to IDROs, the cost and availability is increased. But for rabies, the human beings are getting rabies from dogs. The reservoir animal is dogs or other animals. So we had to follow One Health principles. As dog rabies control programs have not been given the same priority as human rabies, exposure to risk of contracting rabies remains. So at this context, we are conducting this webinar for opening our eyes toward One Health. So for get rid of the human rabies, we had to reduce the reservoirs of virus among dog population. So there are so many neglects. There is no coordination of data sharing, which I have presented. Gaps in surveillance and research. We are following a fragmented approach. So there are gaps in diagnosis and treatment. There are many gaps. Hope that following these lessons learned, we can close labs and we can eliminate the rabies by 2030. Thank you.
Thank you, Dr. Jayakrishnan, for giving us a valuable insight on some of the key areas of neglect, which you have rightly pointed out. A few of them, the neglect in surveillance and reporting and controlling the stray dog population, neglect in conducting molecular epidemiological studies and phylogenetic analysis, as you pointed out, in the Kerala context, timely case-based appropriate death audit. And you've also rightly concluded that rabies control is a priority and One Health program has to be implemented in this. Thank you for giving us so many valuable information from the global as well as the Indian and the regional and the national context. Thank you.